Hello everyone, Doreen Armstrong-Ross, President and CEO of the Dryden Regional Health Center, here with an update for you on the COVID-19 situation. My apologies for the post being a bit late this week. We were waiting on some information that came a little bit later in the week, and we knew we were going to want to share it with you, so we waited to do the post. As you may have heard, the Premier made announcements this week about resuming surgeries and procedures. I just wanted to explain a little bit about what that looks like for DRHC. So on May 7th, a document was released that outlined a measured and coordinated approach to resumption of surgeries and procedures. This document outlines what must be taken into account when a hospital and DRHC is looking at resuming surgeries and procedures. There's quite a few conditions that must be met prior to that happening. We definitely need to look at the local needs, but also in context of the Ontario Health Region needs and the provincial needs. So it's going to be a coordinated approach across the province to resuming these surgeries and procedures. We have had a committee in place in DRHC for a few weeks that were tasked with looking at how we would resume activity within the hospital. What we have done so far is looked at wait lists, some of what we know is going to be changes to our physical environment in terms of, people waiting and being able to physical distance, and the amount of surgeries we can do in a day with the new specifically physical distancing and some of that needs to happen. So we have done a lot of that pre-work prior to the framework coming out from the ministry. Another thing that really needs to happen is the directive number 2 that was issued in March that prohibited us from doing any non-essential elective type procedures also needs to be lifted. It has not at this time. We are expecting that it will be in the next week or 2 weeks, and then we are required to have our plan in place with certain conditions met, and it needs to be sent for approval here at the hospital and then to public health and up into the ministry at different levels. It gets approved. The coordinated approach that needs to happen in the community means that the hospital needs to work with our partners to ensure that the activity here is sustainable for them as well. The rehab services, home and community care services, public health, and long-term care all need to be looked at to ensure that they are able to do their parts of what we do when we do surgeries here. With long-term care, particularly, the concern there is we have been tasked also with ensuring we have a plan in place to redeploy staff in the event that they need our assistance if they get a COVID-19 outbreak in long-term care. We would be expected, and certainly we were willing and able to go help out there to ensure that everybody is safe and cared for. So these are some of the things that need to be in place, and we need to ensure that they're still sustainable when we increase services. A couple of the other types of conditions that need to be met is also around physical distancing, as I mentioned, but also that we need to keep a certain percentage of our beds open in the event that there is COVID-19 patients that need admission. So we have to do that. We also have to ensure that we have enough personal protective equipment for both the surgeries or procedures that need to be done, and to ensure our staff have that in the event of admissions or presumptive admissions of COVID-19. So those are the types of things that need to be looked at prior to any surgeries and procedures being done. We've always been, during this COVID time period, doing urgent and emergent surgeries, but this is more about the not as essential and elective type procedures being being brought into the facility. So I know people are wanting to hear timelines. I don't have that at this time. There's a bit that needs to be taken into account prior to any kind of timelines being decided upon at this point. In terms of long-term care, as I mentioned, we were tasked with ensuring that we could support them in the event of an outbreak. So we've been working here on a staffing plan and engaging with our staff and unions on how that would look if we need to be redeployed. And of course, we have very wonderful staff here that are more than willing to help out wherever they're needed and care for those who need it the most. So we do have that plan in place, but long-term care, particularly in Dryden, have been excellent. They have excellent infection control procedures and have done a really good job of keeping their patients and residents there safe. So, but this plan is in place just in the event that something happens and they need our assistance. So we do have that. That's really my two main updates for today. I've been away from their children and had to keep things running. And also I want to mention that tomorrow starts Nurses Week, and we have some good things planned to acknowledge our nurses and the wonderful work that they do for us here at the hospital. So stay tuned for that on our social media pages. But thank you, everybody. Have a wonderful weekend, and we'll be back next week with another update. Take care.